Dr. Stephanie, can my medications cause dementia? Actually, there is some evidence to suggest that certain classes of medications can make you more likely to get dementia later in life. Before we get to those, let's first talk about some lifestyle things that can also increase your risk of dementia. Having high blood pressure can increase your risk of dementia, so make sure that if you have high blood pressure, it's under control. Sleep apnea is another concern that can increase your risk of dementia. So if you have or suspected of having sleep apnea, make sure you get a sleep test and wear a CPAP machine. Also, midlife obesity has been shown to be linked with dementia. So if you're in your 40s or 60s and you know you're overweight, that's definitely another reason to work on your New Year's resolution, possibly, of losing a few pounds. It will make a huge difference in the long run. But now let's get back to the medications. So there are really 3 types of medications that I want you to be aware of. Let's do an easy one first. So an easy one is one called a proton pump inhibitor. These are classically known as stomach pills. So these would be your ripeprazole, your pantoprazole, your omeprazole. These are medications that reduce the amount of acid that your stomach makes. So we use them for patients that have a lot of heartburn, a lot of acid reflux. But what we found is that patients have been started on these medications and then they've just continued them. So we have patients that have been taking PPIs for years and years and years, and they haven't had heartburn in forever. So this is all to say that if you're taking one of these stomach pills and you haven't had any stomach symptoms, you don't have any acid reflux, this is a great conversation to have with your pharmacist or your doctor to say, like, do I really need this medication? Number 2 are medications called benzodiazepines. These would all end in PAM, P-A-M. So these are lorazepam, diazepam, clonazepam. So these medications are often referred to as relaxers. You may know them by the brand names like Ativan or Restoril. There is a suggestion that benzodiazepine use can lead to dementia later in life. We don't know if that is something that would go away once it's stopped, but it is certainly something to consider. And again, this is another factor where you may be taking one of these sleeping pills. You've been taking it forever. You don't really know if you need it. In this case, that would absolutely be a question that you could ask your pharmacist or your doctor. Class number 3, and this one is a little bit more difficult. So this class of drugs are called anticholinergics. And basically when we say anticholinergic, what we mean is a medication that can dry out your system. So anything that can dry out your mouth, dry out your eyes, constipate you, these drugs are typically anticholinergic drugs. What they found is that use of these drugs over time could be linked to dementia. If you want to think about it, maybe they can dry out your brain as well. So there are a few key medications in this class that I wanted to tell you about. We see a lot of it's bladder medications. So if you have an overactive bladder and you're taking something for that, it's likely an anticholinergic drug. Oxybutynin is one. Myrbetriq is another one. I want you to take this with a grain of salt, because while there has been some suggestions of linkages between bladder medications, overactive bladder medications, and dementia, I don't want you to stop taking those drugs, because what's the alternative? The alternative is that you live with overactive bladder, and that really, really impacts your quality of life. So if this is you, if you're taking overactive bladder medications and you're worried about dementia, why don't you come into the pharmacy? Let's have a conversation, and let's look at some other risk factors that we can get rid of. So that's one. A second one is tricyclic antidepressants. These would be things like amitriptyline, nortriptyline, imipramine. These are antidepressants, but you mostly see them for nerve pain. So again, this is a question of, okay, if it's really helping my nerve pain, great. But you know what? We've had people on some low doses of these medications for a long, long time, and we don't know if you need them anymore. Now, here's the kicker, and this is what I really want you to know. Gravol and Benadryl can also cause this. So Gravol and Benadryl are also anticholinergic, and I know that there are lots of people out there and seniors that are using Gravol and Benadryl for sleep, and they're taking it every night. And I want this to be a public service announcement that just because you can buy these medications off the shelf does not make them safe, does not make them without risk. And here's a great example. If you are taking Gravol and Benadryl, or if mom is taking it, or if Nan is taking it on a regular every night basis, there is a risk. And the risk could be that it might precede dementia later on in life. So definitely keep that in mind. All is to say, yes, there are some suggestions that some medications can make you more likely to get dementia, but there are also some lifestyle factors as well that you can take into account, and you can try to improve. Physical activity is a great way to help reduce your risk. So it's a balancing act. Excellent. If you have any questions, you know where to find me. I'm Dr. Stephanie Burden. I'm the pharmacist and owner at Complete Care Clinical Pharmacy in Rocky Harbor. Take good care.